Pink lips are among the most prominent signs of feminine beauty that many women strive to achieve. Attaining naturally pink lips has become easier thanks to the modern cosmetic techniques available today. Lips can suffer from dryness, cracking, and loss of their natural pink color due to several factors, such as neglecting regular moisturizing or not drinking enough water daily. Excessive exposure to sunlight without using sunscreen, stress, and smoking can also cause the lips to lose their glow and beauty. Additionally, anemia and poor nutrition can contribute to this issue. Lip filler for pink lips is one of the most commonly used methods to achieve fuller, rosier lips. This procedure is simple and considered one of the most popular ways to enhance both lip volume and color. As we age, the skin loses collagen and fat, which leads to the appearance of wrinkles and dryness. The same applies to the lips, which may appear dry and dull. Lip filler techniques work to restore what the lips have lost in terms of collagen and fat through the use of dermal fillers. There are several types of fillers used, but the most popular and safest is hyaluronic acid filler, as allergic reactions to it are rare. After injection, the lips may become slightly swollen and small red dots may appear, but these effects usually subside shortly after. During the procedure, the doctor applies a local anesthetic on and around the lips, then injects a small amount of filler to ensure there is no allergic reaction. If no reaction occurs, the filler is injected fully. Thanks to the anesthetic, the process is virtually painless. The effective lip filler for pink lips typically lasts 6 to 12 months. Another method for lip tinting is plasma lip rejuvenation, platelet-rich plasma or PRP, which involves using the patient's own blood plasma and injecting it into the lips. This technique provides a youthful and fresh appearance, making it the ideal choice for women who prefer natural substances and are concerned about allergic reactions to synthetic fillers. PRP lip tinting differs from filler injections. While fillers depend on hyaluronic acid that binds with water molecules to add volume and color, the PRP technique works by repairing and regenerating cells and stimulating natural collagen and elastin production. This restores the lips' healthy and rosy appearance. Injecting PRP into the lips helps too. Improve the appearance of vertical lines on the upper and lower lips. Reduce fine lines around the mouth. Enhance lip texture and make them smoother. Give the lips a healthy pink tone. Make the lips appear fuller and more youthful. The mesotherapy technique relies on using several fine injections to deliver a combination of vitamins, minerals, and essential nutrients into the lips, giving them a healthier appearance. Lip mesotherapy, mesolip, improves the overall look of the lips, providing the desired pink color and fullness. The lip lightening mesotherapy session takes only a few minutes and can be repeated multiple times to achieve the desired results. Lip tint injections. The use of lip tint injections has gained great popularity recently. This technique involves injecting hyaluronic acid mixed with glycerin into the lips, giving them a pink and plump appearance. The results of lip tinting using pink injection typically last between 4 to 6 months, after which the treatment can be repeated to maintain the effect.